Hi, sorry I'm late.
That's okay, Chris. I'm Barb.
Hi, Barb.
Nice to meet you. Did you have troubles finding our place?
I did get a little lost. I thought my wife told me where to go, but I got it mixed up. Sorry, anyway.
That's okay. And what brings you here today?
My wife, I guess, well, I came back from Afghanistan. I was deployed there. Came back earlier this year, and she says I'm just not acting the same, that something's different, and maybe it's affecting my work, and I should go in and talk to someone.
And what do you do for work?
I work in construction, same job, before I was deployed, and I guess one of the challenges I'm having right now is I got a DUI a couple months ago, so I'm riding my bike in right now, which is working, but when the snow flies, I can't do that.
Now, is this your first DUI?
Yeah.
So this is something new for you, to be drinking and driving?
Yeah, I mean, my wife has said too that it seems like I'm drinking more. I don't know.
Okay. What about, do you have any other issues on the job?
Yeah, I mean, I'm doing the same kind of work. I've noticed there's some things that are a little different for me. For some reason, since I've come back, heights bother me more. I feel like I get dizzy when I'm up on scaffolding, so I try to avoid that. And some of the equipment that I used to use, like the pneumatic hammer, I used to operate that a lot. And now I can't operate it with the same precision that I used to.
Does the noise bother you?
It can, and the light, I'm finding that I have to, I get headaches if it's too bright, if I'm working outside all day.
Right, I notice you're wearing a hat with a brim. Is that because of these lights?
Yeah, I just kind of wear it all the time now.
Okay. Now, when you were in Afghanistan, did you ever get involved with or be part of an IED explosion or anything like that?
I mean, I was never injured by one. I was around them. There was one that threw me across the street. I hit a building, but I didn't black out or anything, so I wasn't really that injured by it. But that was the closest I ever got to one.
Okay. And has anybody ever mentioned the fact that you do not have to lose consciousness in order to have a concussion?
No.
When you left Afghanistan, did you have any kind of assessment for concussion?
They do ask you some questions, but, at that point, you just want to get home, so I knew what to say and just kind of get to my family.
Yeah. Now, so, have you ever seen a list of kind of symptoms of concussion?
No, not really. I don't think so.
Okay. One of the things we've done here at Oak Rehab is that we've developed a whole set of questions to help us try to figure out if someone concussion is part of the reasons they might be having difficulties. Would you be willing to answer some of those questions?
Yeah, sure.
Great. Let me pull out that tool.